Right, good evening. I want to thank everybody for coming to the tuberculosis information session, and I want to explain why I put this together. I find that it's important for healthcare workers and new healthcare workers that will be working in the medical field to be familiar with their different contagious diseases that you will be coming in contact with, and tuberculosis is one that could possibly be one that you're exposed to. So I'm going to start with going over some of the microbe information. The most common species of Microbacterium to cause human infections are Microbacterium tuberculosis, leprae, which causes leprosy, Microbacterium avium complex, which causes systemic infections in people with HIV and AIDS. And then there are some other ones that cause tuberculosis-like infections, especially in immunosuppressed hosts. Microbacterium also can cause infection in cattle, which is Microbacterium bovis, and also an infection in wood mice, Microbacterium macroti. Microbacterium is long, slender, and rod-shaped. It grows slowly. The size of the bacillus is between 0.4 by 3.0 micrometers. It's known as the acid-fast bacterium because it will resist decolorization when acid alcohol is used, and it will cause it to stain red. The cell wall is composed of peptidoglycan and mycolic acid. The mycolic acid is a lipid layer that protects the microbe against antibiotics, antibodies, and chemicals. It also allows the organism to survive and not be ingested in phagocytic cells. The mycolic acid also allows the bacterium to live longer in dry environment, meaning if you come in contact with dry sputum, you could be exposed to TB. Is there a problem?
You should probably be taking notes instead of rolling my papers.
Tuberculi bacilli do not produce spores, flagella, capsules, toxins, or enzymes that are usually involved within the disease process. But because of the mycolic acid in the cell, that's what causes the host to become ill. The bacillus, they do consist of genetic material, vacuoles, ribosomes, and granules. Yes, ma'am?
How is it transmitted?
TB is transmitted from a person with active TB to a healthy person. It's transmitted through the healthy person inhaling microscopic droplets from the person, the active person, as they cough, sneeze, sing, or laugh. It's only transmitted from active person to a healthy person.
And what are the target organs again?
The target organs are the lung in humans, and in animals it's the GI tract or anywhere in the animal. Yes, sir?
What are the signs and symptoms?
Symptoms? The cough that lasts 3 weeks or longer. Sometimes there's blood in the sputum. Chest pain, weakness or fatigue, weight loss, no appetite, chills, fever, and night sweats. Yes, sir?
What is the treatment and how long is the treatment?
Treatment can last anywhere from 6 to 9 months, and there's different antibiotics that they use. Yes,
Is there a vaccine?
There is a vaccine, and for short it's called BCG. It's not really widely used in the United States, but it's recommended for children, people who travel across seas, and also for healthcare workers. Yes.
Also, how's it diagnosed?
There's different ways it can be diagnosed. The first one normally is a PPD test where they put some tuberculin underneath the skin, and in 48 to 72 hours later they look at it and read it, and they measure it and see how big it is. If it is large enough to be considered positive, they'll send you for a chest x-ray, or they'll do sputum cultures and that kind of thing.
Does TB cause any complications?
TB can spread to the lymph nodes, causing swollen glands to the side of the neck or under the arm. It can also it can spread to the bones and the joints, which causes your knees and your hips to ache. It can also go to your urinary tract, which causes frequent urination, pain while urinating, and blood in the urine. It also can cause meningitis in children, a pneumothorax, and a lot of different other systemic infections for HIV patients. Any other questions before we end our information session? All right, well, thank you for coming, and I will see you guys again next week.